Hey, good morning, and welcome to the UroPatient podcast. I'm your host, Vaccination. Welcome to the show. If you're watching us live, we come to you every Saturday at 10:30 a.m. on the Facebook page and YouTube page. If this is your first time checking us out, be sure to check out our website at UroPatient.com. Best place to go to catch all of our past episodes. Also, the best place to download our handouts. We put out a new handout every week with our show, so it's always something helpful for you to have. So be sure to check that out too. This week, we're going to be talking about genital warts, what you need to know. So let's go ahead and get right into our show. And we have for you a cautionary tale of Goldilocks and the Three Bears. These three would soon learn that one night with Goldilocks meant a lifetime of condylocks. Yes, condylocks or condyloma is the HPV virus. Subtype 6 is the one that causes warts. There's 200 forms of HPV, just so you know that. And the papilloma are these what we call genital warts. They can be treated, but they cannot be cured. You can remove the warts, but you'll still have the HPV virus present that causes them. This may go away at some point on its own. There's no way to know for sure. Some people get the warts. Sometimes they get treated, never come back. Sometimes they do come back. So keep that in mind. Now, one of the ways you can differentiate warts from things like skin tags or other lumps and bumps that you may see on your genitals is by their appearance. They tend to look like cauliflower. Now, I know I probably wrecked cauliflower for a lot of people out there, but my best way to describe them. Now, how do you get these warts? Well, the HPV is a sexually contagious disease. So you get this from an infected partner through either oral, anal, or vaginal sex. In America, a recent study done in 2018 by the Superdrug Survey showed that the average number of sexual partners in the US is 7.2. So that means that we've got greater exposures because when you have sex with someone, you're not just having sex with them, but all their past partners. Kind of makes sense that you're getting exposed to anything anybody else has ever been exposed to. So if any of those folks, those 7.2 partners had genital warts, there's a chance that you could get them from your partner. Keep in mind that these warts, although external on men and pretty much easy to see, are internal or vaginal on women a lot of the times. They can be external also, but sometimes they're not visible. So keep that in mind that exposure to the warts is how you get this. Now, large warts like we see in this picture here, and let me just get my pointer out here. So like we're seeing here, these kind of big warts there, those have to be surgically treated either by cryo, which is a freezing agent, or cautery that kind of is a electrical burning, or even a laser burning. So the smaller ones like we see here, little things like that can be treated with a medication. If that's all you have, that's great. That's what we would start on a medicine. If it's bigger, you would have to have surgical removal, and then the medication you could use to treat any recurrence. So what is that medication? Well, that little ditty about condylocks. Condylocks is our number one go-to agent because it works well. It's pretty easy to apply. When condylocks fails, there's another one out there called Eldera, another option that we can utilize. Most important, though, is how you use this medicine is very strange compared to how we treat most things. So it's got a cycle, and I've got the instructions there written down for you. But just to kind of go over that, what you're going to do is you're going to apply it twice a day for 3 days. Then you're going to skip 4 days. So a 1 week period of treatment. So 3 days on, 4 days off. And then you'll repeat that cycle up to 4 times until you've gotten rid of all the warts. Now, if it goes away in 2 cycles, great. But up to 4. If it doesn't go away, that's when you need to come back and have us check things over, see if it's something we need to surgically treat or switch it to something like the Eldera. Now, the other important thing is when you put this stuff on, you've got to put it on just a tiny amount. Everybody, thinks a little bit is okay. A lot is even better. No, you got to use a very small amount. That's why I have a Q-tip there, because I think using a Q-tip is your best way to treat this so that you don't get too much on. Small amount and let it dry. A lot of men will, put it on the penis. It doesn't dry. It flops down on their scrotum and it'll burn the scrotum. I've seen scrotums as red as this guy's sunburn. So Be very careful. Make sure that you let it dry and you use the smallest amount necessary. Now, the other concern we have with HPV is certain types of HPV can infect the cervix. These can cause cell changes that may, over many years, increase your risk of cervical cancer if the body doesn't clear the virus naturally. These types of HPV, though, are not the ones that cause genital warts. So if you've got genital warts, it doesn't mean you're going to get cervical cancer, but it does increase your risk. So what do we need to do? Well, the number one way to protect yourself is through prevention. So you need to use some kind of preventative way to keep from getting exposed to somebody who has been exposed to this. Number one thing that we can suggest is using a condom, a barrier type protection. It reduces the risk, but does not eliminate it. So be sure to know that. I've seen patients come in that have had a ring of warts around the outside where the condom didn't cover. So, it happens. There is a female form of the condom. It's just not really popular. In the US, they say only about 2% of people have ever used one. So it's a kind of rarity, but it's got a bigger coverage. So it would probably protect even better. But again, it's not very commonly used. The other thing you can do is there is a vaccine available that can be given to prevent the HPV virus. It's called Gardasil 9. And it treats 9 out of the 200 some variants, but it's the variants that are most commonly associated with cervical cancer and the wart. So we do recommend the vaccine for boys and girls starting at around the age of 11 or 12. Can start as early as the age of 9, and a catch-up vaccination is recommended for females up to the age of 26 and males up to the age of 21. So the HPV vaccine is highly effective at preventing infections from the strains it covers. It reduces the risk of HPV-related cancers and warts. So definitely worth getting. Now, again, as I said, there's always a nice thing to look at where you can check out our website to get a handout. This handout will cover everything you need to know about the application of Condolox. And so go ahead, download that. It's free for you. Just go to our UroPatient.com website to find that. So, hey, I hope you enjoyed that episode. Hope it was informational. Be sure to be safe. And when you're not, make sure you come in and be treated. So safe or treated, we can take care of you. So, hey, that's all I have for this week. We'll see you next week on another great episode of the UroPatient podcast. Thank you.